If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got a cool guest with us. Very busy individual. I appreciate your time. This is Dr. Celina Moore. She's a pediatrician locally in West Palm.
Yes.
Thanks for coming in.
Absolutely. Thanks for inviting me.
So tell us more about where you're at, your practice, and what you do.
So the short story is I have a concierge pediatric practice here in West Palm, and I service the entire county for concierge pediatric needs. But that came from almost like a disgruntledness maybe, or I had to really step away from traditional pediatric medicine, the way it's, yes, that's the word I was looking for. Yeah. Because in you have a baby and you make an appointment and you have to like dial the pediatric number and go down the phone tree and wait on hold and get an appointment and then sit in the big waiting room and then go to the little waiting room and your kid's coughing everywhere, and then you get a whole 7.5 minutes with a pediatrician. If you don't have a list, then you lose your chance, and it's very dissatisfying both from the parent point of view, but it's also really frustrating from the practitioner point of view, because there's so much more that we can give to these families to help their kids thrive. And we are constrained by the limitations of what the insurance company tells us we can do with the time that we have.
Right.
So I stepped away from that the beginning of 2025, and I started my own practice where, I am released from those limitations, and I can do house calls and I can spend as much time as I want with my patients. The patients have a lot more access to me. They can call and text me if something pops in your brain and say, hey, wait a minute, I just read this article. Is this true? Is this not true? Or my kid just did this. Should I worry? Right. And having the more of like a high touch, hands-on approach really decreases all the barriers to care. Yeah. So it's very fulfilling both as a pediatrician and also on the parent side.
Yeah, totally. Yeah. That makes total sense. Yeah. We have, we got 3 kids.
Yeah.
My daughter will be 5 in a month, or like a little less than a month. My son is 3, and then my youngest son is 6 months. So we're grinding right now.
Yeah.
But yeah, so like, I forget something happened recently. We called in and like it just takes a little time, like it's just a bummer. In the waiting room, yeah, of course, there's like the sick side and then there's like the healthier side. So it's like but like what toddler, is going to follow directions?
Well, it's like back
there's
when I was—
There's a lot of blending over there.
Right. Well, like when I was a kid, you would walk into the restaurant, they say smoking or non-smoking. Yeah. And you're just like, it's the same air.
Yeah, I can still smell it over here, guys. Right. Yeah, exactly. Well, that's good. And also too, I'm like, I would agree as well. Like the dissatisfaction, just not feeling as fulfilled as you can and frustrated from a practitioner standpoint of like trying to help people. Would have plenty of people in previous life when I was doing my thing in the clinic, just like you said you were doing, where people would be like, can you do more like of the manual therapy? And then I want you to teach me some stuff. I'm like, I wish I could. I can't. Yeah. I don't have the time.
Yeah.
I'm managing 5 other fires. You know what I mean?
Yeah.
It was just a bummer, And then, pediatricians like yourself, docs, like usually they get into the field because they're philanthropic. They want to help people. They're warm and fuzzy. They want to like get a relationship and help people. And then you're strangled, which sucks.
Yeah. And the burnout rate right now in medicine is atrocious. It's atrocious. And it's really sad. And I really, feel for my physician colleagues who are kind of stuck in this right now, because this is not the ideal model for everybody, but it's working well for me and for my patient population. So I'm really happy.
Yeah. Where are you from originally?
So I grew up in Baltimore.
Okay.
Yeah. I'm a Baltimorean.
Okay.
Yeah.
That's awesome. I've never heard that before.
I may or may not have made that up.
That's funny.
And I moved to South Florida. Actually, I did my residency at what's now known as Nicholas Children's, but it was Miami Children's. Okay. So I was there from 2001 to 2004, and then moved back up to the Northeast for a year, and then bounced right back down in 2005, just in time for bunch of hurricanes.
Yeah.
Yeah.
Yeah. I remember that specifically.
Yeah, but it was the
2004, 05.
Katrina, it was Wilma.
Yep.
Yeah, I was like, what is this place?
Yeah.
And and I've been here ever since. So I practiced pediatrics in the Boca Raton area for about 20 years before I shimmied up a little bit farther north.
And did your own, started doing your own thing.
Yeah.
Where'd you go to med school?
So that is, that's a story. Yes. So I was a French literature major in college. Because French lit. I decided when I was quite young that I wanted to be a pediatrician in Francophone Africa. I'm talking about like kindergarten. I'm like, I want to be a pediatrician in Francophone Africa or a waitress. Those were my two career paths in kindergarten.
Interesting.
And I followed that through. I mean, I did wait tables, and that was also frustrating. But I ended up saying to myself, well, I want to join Médecins Sans Frontières, Doctors Without Borders, and I want to go to this part of the world. And in order for me to do this, and I must learn French. And so I did my pre-med in French literature and pre-med. Mm-hmm. And then, spoiler alert, that's really hard to get into medical school with a French lit major. So I ended up moving to Spain, where my family's from, and I started medical school in Spain. And then from there, there was medical school in the rest of the world is different than the United States. You go straight from high school to medical school. And then there it's a 6-year program where you do your prerequisite that we would do in pre-med. And then you would do straight medical school. Then you do what's called an internship where you are doing a lot more clinical work. And then you do a social service year where you give back to the community in what you've learned in medicine. And you have an exit exam at that time. And depending on how you do it, that exit exam is kind of placing you in what residency program that you want. And I've only wanted to go into pediatrics. Like, GI doesn't do it for me. Feet don't do it for me. Eyes don't do it for me. I want to do the whole kid. So the way it was going in Spain, I'm not going to get into all of it at that moment, but led me to pause and think maybe I need to go somewhere else. Yeah. So I ended up moving to Mexico, and I did a few years of medical school there. And my last year, like my diploma says New York Medical College, but I did the bulk of it overseas.
Cool.
And then I did my residency in Miami.
Yeah.
Country number 4.
Yeah, exactly. Right? Yeah. Wow.
So yeah, that's what I did. And I think it made me into a very well-rounded, both culturally and academically person. And I can really, especially when dealing with different cultures around the world, gives me that perspective that, okay, just because this is the way things are taught in the United States, it doesn't necessarily mean that that's how you have to practice medicine.
Yeah.
Completely.
True.
Right? Yeah.
Yeah. You sound like you have a lot of exposure, like a lot of cool experiences and stuff. Saw a lot of things.
Yep.
So you've always, pediatrics was always your thing.
Always.
How come?
I don't really know. I mean, the classic thing was like, I love my pediatrician. I'm like, I don't really have any warm and fuzzy feelings about my pediatrician. I thought he was kind of dry, and he never smiled at me. And I thought I was funny because I would say, why are you named Dr. Katz? You don't look like a cat, right? And he did not like that.
So moving on.
But I love children. I love their role in the family. I love thinking. I love figuring things out. I love puzzles. I love trying to come to a conclusion, right? So I really like that idea of medicine of this is what is presented to you in this way. And everything that I learn up until now is going to help me get to the answer of this question, whether it's a diagnosis or if it's, helping somebody with something. Yeah. And I'm also I was voted most helpful of my 8th grade class. So I like to help people.
Oh, okay. That makes sense. Yeah. That's awesome. So with recently your practice, you see a wide range of kids.
Yes.
From infancy through 18 years old.
Through university. I take them through college.
Oh, wow. Yeah. Okay. Awesome.
Yeah. They're big kids then.
Yeah. Big kids. Yeah. That's a journey. That's awesome.
It is.
When the patients the people that reach out to you and say, hey, what do they usually ask you when they want to work with you? Like, what do they usually ask?
I get a lot of, what's my philosophy on ... Like, how do I think about this? And as you saw, the answer to a short question like, where did you go to medical school, ends up becoming a big answer.
Well, let me explain. Yeah.
So that usually starts the rapport, right? They ask me a question where they think it's going to be, a one-word answer, and I just vomit all this information onto them. Yeah.
Which, I mean, I'm sure they would appreciate the enthusiasm and like the knowledge, like the information.
Yeah.
Thanks for going the extra mile and explaining things. What do they usually ask? Like, what's your philosophies on
antibiotics? What's your philosophy on parenting? What's your philosophy on immunizations? What's your philosophy on illnesses? I think as more people in the wellness industry start getting more of a traction on social media and, the just health at large, it's very, very important to, as a physician, to be able to fill in the role of truth seeker and making sure that there's how to discern information that's coming at you, towards you. And it's a very exciting place to be in because there's so much out there that I did not learn in medical school. So I'm applying what the tools that I learned information in medical school, like how to see if this data is true or not, right? If there's any spin to it, and then applying it to what's coming out right now, whether it's having to do with food safety or food health or nutrition or gut microbiome or developmental issues or immunizations, like all of that.
Yeah.
So I think I'm poised to be able to, show light on what is true.
Yeah, for sure.
Yeah.
What do you feel like you learned a lot that you weren't exposed in medical school?
Definitely nutrition. Absolutely nutrition. We got, I think, 6 weeks, maybe. And most of it was on feeding or refeeding different pathologies. So if you are in cardiac failure, this is what you should eat. And if you're in renal failure, this is what you should eat. But there wasn't really that much on micronutrients and health from just an every person point of view.
Yeah. I mean, I would always suggest to patients like the most influential thing for someone's longevity and trajectory is just like what they consume consistently. And I mean, it took a little bit in undergrad, nutrition, but definitely, I'm a hobbyist when it comes to nutrition. Like, so like an educated hobbyist on that. I think it's fun and cool. Not a nutritionist though.
Right.
But anyway, I totally agree. Like, it's super influential with somebody's health and wellness longevity trajectory. What do you find yourself recommending to patients now with nutrition?
Well,
like you said, like micronutrients, like what do you mean?
Well, what I mean by micronutrients are more like your vitamins and the minerals that are found in foods and how to make sure you have a good balance. And looking at what the American diet is and looking at what the American dietary recommendations are, both fall short of what we really should be consuming. And this should start in infancy. This should start before infancy. This should start before conception.
Yeah.
And, making sure that this is something that we're able to control. We can't control genetics. We can't control the diseases that are passed down generation by generation, but we can control what we put into our bodies, and we can control the exercise that we do, in our lifestyle, and how to avoid things that are going to hurt us. And if you're able to do that in infancy and toddlerhood and early childhood, then we can, take what we've learned and continue throughout childhood and adolescence. Because in adolescence, that's when everyone's going to go, I don't want to do this anymore. But hopefully it will be ingrained enough, the good habits that you can then carry that into adulthood.
And what do you find yourself recommending to toddlers as an example? Like the parents of toddlers and are like, hey, incorporate this.
Mm-hmm. So the easy way to do it is I tell parents, especially parents of children a little bit older than toddlers, and I always speak to the children. I speak much more easily to children than I do to grownups. But, I tell the children, like, do you know where this comes from? If this comes from, you can like trace it back really easily, then you can eat it. But if it comes out of a crinkly package, or if it comes out of, a piece of foil, then it's probably not good for you. So if you can look at that hamburger, for example, and you can say, oh, I know that B, that came from a cow, right? And I know that lettuce came from the ground, and I know that slice of tomato came from a tomato plant. And then I'm like, okay, I can eat that because I know exactly where that comes from. But when I open up a Pop-Tart, I'm like, I don't know where that comes from.
Yeah.
There are so many steps to make that Pop-Tart.
Yeah.
And then you can even break it down even more healthily. Like, I don't know where the cow came from, but I know where the eggs came from because it came from my neighbor's yard. So I know I can eat that, right?
Yeah.
And then just teach them like little things at a time. You can't give a dissertation on nutrition to the parents of a person who's just making sure their kid's not going to stick a fork in an outlet or something.
Yeah, exactly. Exactly. Or man, it's rough. Like
5's a handful.
It's
yeah.
Exactly. Nice. That's awesome. It's a hit or miss, like every day, like some days they're like, sure, I'll eat. And then some days they're like, I don't want that.
I don't want that.
Yeah, I want milk right now. I'm like, bro, you already had like 5 glasses of milk. Like we need to have some sustenance, Okay. You can have a treat if you have this.
The parenting part is
the bargaining,
really hard. Yeah.
Then there's a whole bunch of philosophy on that we're not going to like.
My wife, a whole other podcast.
Yeah, exactly. And I was like, well, you shouldn't do that. And I'm like, oh my gosh.
Yeah.
We also need to go to bed and it takes time.
Sometimes Publix runs out of milk.
Yeah. There you go.
They just run out of milk.
That's a good way to put it.
Yeah.
Hey, we ran out. I'm so sorry.
None left.
We have done that for sure.
Yeah,
and there's a meltdown, but then they get over it.
Yeah.
It's totally fine. All right. So mentioned, there's a lot of hot topics right now, right?
Yeah.
What have you found? Immunizations being one of them, right? Vaccines. What are your thoughts on those? Like of the recent things coming to light? I know COVID was a huge exposure moment for a lot of people because the COVID vaccine, the disease in general, the media's role and all this stuff. But anyway, what are your thoughts?
3 words: vaccines save lives. They absolutely do. And we have not seen a lot of these diseases. And so we're not afraid of them anymore. And what's going to happen, and what has been happening, is when you're not stopping the vaccine, stopping the illness, stopping the bug that's causing the disease, then there's going to be, kind of like a global amnesia of like, oh, this is not so bad. And then there's going to be a resurgence. And that's happening. And
anything in particular?
Oh, measles. Yeah. Whooping cough is back. We just had a colleague of mine just had a 4-day-old that tested positive for whooping cough. And whooping cough can kill that age, right? So there's a reason why we want to protect our children. Having said that, I completely understand and empathize with parents today who are looking at a vaccine schedule and saying, what the hell? Like, what is this madness, right? And I love history, and I love medical history, and I love vaccine history, and I love being able to explain why we do the things we do and why we know these things are safe, while at the same time balancing the trepidation and the hesitation and knowing that there is a lot of noise out there that is not giving complete accuracy in what they're presenting in terms of harm from immunizations. And I do have families who say, you know what, I am like really, really nervous about this. And I'm like, okay, wait, I'm not going to stick needles in your kid behind your back. This is a conversation. And this is, it's not just a one-time conversation. This is a conversation over a childhood. And I am more than willing to address your fears. And I'm more than willing to show you the data and why we do the things that we do. And I also respect you for making the choice that you believe is the right choice for your child, because we both have the same end goal. And the same end goal is protecting the child.
Yeah.
Right. And so I completely understand it. But I come from a land of science, and I come from a land of wanting to help and protect. And having seen children die of whooping cough, having seen children die of varicella, of chickenpox. I mean, even in the early 2000s, kids who were immunosuppressed because, they were undergoing bone marrow transplants or chemotherapy or whatever. We try to protect those who cannot protect themselves. Yeah. And that's the idea of immunizing a population, because there's going to be a certain threshold where we lose our herd immunity. Herd immunity.
Yeah.
And we all know all these terms now because of COVID.
Yeah, exactly.
Right? Yeah.
I was reading somewhere recently, there's, over 80 in some states 90 vaccines on the schedule for what number is that in Florida?
You know what? It's the same over all
It's
the United
federal.
States. It's worldwide. I mean, these are the vaccines that are available to everybody in the world, and these are ones I haven't counted it. If I were to count each antigen over the course of a childhood, probably in the 60s, but don't hold me to that because I haven't gone through that yet.
Yeah.
But what I do know, and I am. So I had my first immunization in 1973. So it's 51 years ago. Now I just told everybody my age. All right. Anyway, all you out there. So
it's experience.
Yes, there we go. Yes, it is. So I had my first immunizations at the age of 2 months in 1973. And I had a diphtheria, tetanus, whooping cough, DTP. And I had an oral polio vaccine, which was the drops in the mouth. And I had that at 2, 4, 6 months. And then when I was 1, I had my MMR because the MMR came out in 1963. So I was 11 years old when I got my MMR. And then I got all my boosters, before kindergarten. That first tetanus shot that I got in December of 1973 had more antigen in it, more vaccine, more particles, more protein than all vaccines over a child's entire childhood, from his birth to 18 years of age, put together. So the amount of vaccine per syringe, per shot, has drastically come down. And the number of diseases that we could prevent has drastically gone up. Mm-hmm. But when you're looking at the schedule and you're looking at how many Band-Aids are on the tray and how many needles there are, it seems overwhelming and scary. But the science just gets better, and we stand on the shoulders of giants, and we see that I can decrease the dose of this vaccine and make it safer and better and more efficient than what I got 51 years ago.
Yeah. Interesting. And to clarify what I was asking, people wouldn't understand what I was saying, but because I didn't say it, but the immunization requirements for school.
Oh, yes. Mm-hmm.
Right. That was there's, I don't know, it's a plethora of vaccines and stuff. And the big question right now is the relation of autism to all the vaccines. What have you seen with that?
Well, those are two questions, right? So the first one is you have a certain amount of immunizations you need in order to enter school. And that's, when you go to the pediatrician, you get a form, and those are not all the vaccines that are recommended by the American Academy of Pediatrics or the ACIP, now defunct RIP, or even just to stay healthy. Mm-hmm. But those are the ones that are probably the most communicable from child to child, right? So that, I don't think, varies too much state to state. Like, for example, we recommend babies get a hepatitis A vaccine when they're a year old, and that's not on the form, and the flu shot's not on the form, and COVID obviously is not on the form, or the Gardasil, but most of the other ones are. And we do that in order to protect kids that wouldn't be able to get the immunizations themselves. So you might have a 5-year-old who's completely up to date on their vaccines, and then they develop some horrible disease that wipes out their immune system, and now the person sitting next to them can give them one of those diseases, right?
Right.
And the schools are not allowed to disclose if everybody has all their immunizations because of privacy.
Yeah.
But everyone needs to have the form. And there are people who can get what's called a religious exemption, which I think should be renamed like a philosophical exemption. But you can go to the Department of Health and say, I'm not going to immunize my children and I want this exemption. And they're going to say, here you go. And with that paper, you can go to school and you can still get in. So it allows a little bit of freedom of parenting for parents who say, I really don't want to do this. But it comes at the expense of perhaps harming somebody else. So there's that. To the autism question. So this all started there's always been vaccine hesitancy, even since the smallpox, right? But the big jump happened in 1998 when Andrew Wakefield, who is a gastroenterologist, published a study in The Lancet, which is one of the periodicals of medicine, stating that he thinks he knows what causes autism. He thinks it might be the measles, mumps, rubella vaccine, the MMR vaccine, and this is why. And basically what he did was called a retrospective study where he took children already diagnosed and looked backwards and did colonoscopies on them and said that there's this, there's this leaky gut idea, and that these toxins from this vaccine traveled through the gut into the brain and then caused the autistic symptoms in these children. And it was the huge sensation, right? So we're like, oh my gosh, we got it. We now know what's causing autism. Great. But as we learned in 4th grade biology class, there's a scientific method where, you have to have this hypothesis, and then you have your, the way that the methods, like how you're going to be, doing this experiment, the data that's collected. And then the last part of it after the conclusion is the reproducibility of it. Can somebody else do this? If they read my paper, do the exact same thing that I did and get the same results? And that's where it fell through, that it was not able to be reproducible. And then after that, lots of other stuff happened. There's, most people retracted their names of the authors retracted their names. And then they realized, Dr. Andrew Wakefield ended up losing his license because he was trying to, for ethical reasons, he was trying to produce another vaccine to compete with the MMR. And that was unethical. He's trying to discredit the MMR through the paper and then, and make his own vaccine. So that he lost his medical license over that. But the damage is already done because we're still talking about it. 27 years later, we're still talking about it. I am not saying that all vaccines for all people at all instances are safe. I can't even say that about our drinking water. I cannot say that about Tylenol or Benadryl or anything that we regularly put into our bodies. Nor am I saying that we should all make up our own vaccine schedules because of just vibes, right? But I do pay attention to risk factors. If there's been a family history of vaccine injury, if there's any history with a family member with immune issues, either hyperimmunity or disimmunity, like immune dysregulation, I pay attention to that. And we have a discussion about it. But I'm still encouraging children not to die from preventable deaths.
Right. Yeah. We have a friend recently that, and it's always so hard. We get so much information, don't know what to believe.
Right.
But we have a friend recently that was sharing that their child, I think, was at the time like 5 and was getting another schedule of vaccines and was doing well, progressing, talking, all that stuff. Got a vaccine. Week later, wasn't talking, having speech issues and whatever. Thinking like, anyway, they were saying like, I don't know.
Right.
But this vaccine thing just happened. A couple of days later, boom.
Right.
With nothing else, it seems like was intervened to have caused this delay. But anyway, it's just, I hear stories like that.
Right. And they, I mean, I'm not going to give medical advice over a podcast, but
of course.
This is something that happens, and it's not necessarily, I mean, yes, it's due. To be very careful with how I say this. There are other things that can trigger this, right? So there are underlying genetic abnormalities that need a trigger. And the trigger can come in the form of a virus. It can come in form of an exposure to like a toxin, like a pesticide or something like that, or a trigger like an immunization. And so when those things happen, you look at what the trigger was, and then you say, oh my gosh, we need to get rid of this trigger. But what the real problem is this underlying genetic abnormality that got triggered.
And now it's expressed. And then
the best way I can explain that is type 1 diabetes is like this, right? You're born with this genetic predisposition, and then there is a circulating virus that triggers it. And then we see this in pediatrics that the first time diagnosis of type 1 diabetes comes in waves. Like we see it in the hospital, like you see 5 kids come in 1 week with first onset because the circulating strain of viruses that is going through is hitting the people who are predisposed to this and then causing that autoimmunity. So that's what's happening. I'm going to go back to that question that you said originally about autism and immunizations. And there was, with that landmark paper that started everybody talking about that was in 98. In 2000, and then I want to say 2012, but I'm not 100% sure. There were two huge studies that were published. One of them was a Danish study, and one was a Finnish study, where they took huge populations of 600,000 and 1.2 million in the other of children, and they followed them prospectively. The children were born, and then they followed them for 7 years in one study. I can't remember how the other one. And then they divided them into the ones who were fully immunized and the ones who weren't. And they saw the exact same rates of autism in both.
Interesting.
Exact same. So that was in 2000 when that first study came out. All the pediatricians who since 98 were like, what are we going to do? What do you think? Whatever. We're all like, okay, now we know it's not vaccines. Now, do vaccines or anything in their environment play a role in it? Absolutely. We know that autism is genetic, and we know that there is this multifactorial, as we call it. There are other things that come into play.
Right.
But because, all kinds of autism are different, like you see one autistic child, you just tell me, I see one autistic child. You can't define autism by that one child, right? So it expresses in different ways and is being caused by different things. And when science catches up and says, aha, this is what it is, then we will all, as new parents, breathe a little easier. But up until then, we just have to really make sure that we are not causing more harm by withholding immunizations that are life-saving to children just out of fear of autism.
Right. I mean, I would totally, I'm a, person of science as well.
Mm-hmm.
By no means the same education as you are in that realm, you know what I mean?
Different, yeah.
But I remember in school, in undergrad, I was a biology major. I was debating med school for a minute.
That's what I should have done.
Yeah, exactly. I was a French literature major, decided to swing away and go into medical.
Mais oui.
Yeah, like, what is it? But I remember one class in particular, like they were like, every time you get a vaccine, I get sick. I think vaccines are making me sick. And I was like, that's like impossible. They're dead viruses that's not causing you to be sick. And maybe it's a placebo thing, Anyway, people are like, oh my gosh, this is like, 15 years ago. But anyway, I've always agreed, vaccines are made to save lives. They're vaccines to help express immunity and antigens and stuff, so we become better equipped to handle viruses when they come about, right?
Right.
And same thing with antibiotics, right, for a bacterial standpoint, just to fight off the bacteria and be good. There's a lot of skepticism of like what else is included in these syringes when they're injecting, whether there's been ammonia or aluminum and mercury found in them. What have you heard? What are your thoughts on that? Or like, what have you heard on that?
Well, back about feeling sick after getting an immunization, it depends on the health of your immune system, right? So the immunization is priming your immune system to recognize this bug so that when the actual bug comes into view, then you've got your defenses already done. So some people are a little bit more sensitive to that, and they feel like a little bit more run down after getting an immunization because their immune system's working, right? Kind of how you feel sometimes a little crummy, like the day after a really strenuous workout, and you're like, oh, I shouldn't have done that. And you're like, no, I really should have. I just have to like recover from this. Right. Yeah. Exactly. So, immunizations are like that.
That makes sense.
Yeah. And some people everyone's different, right? So I'm the type of person that I can get a bunch of immunizations and I just keep powering through it.
Yeah.
But I can tell you that second or third COVID shot I got, I was like, oh, this is what people talk about.
Interesting.
Because I felt it with that one.
Yeah.
And now I forgot your question.
It was the
the adjuvants and the things that are added to the vaccines. Yes. So when I was in medical school, it was when the hepatitis B vaccine was pulled off the shelves because of a worry about the preservative in it called thimerosal, which is mercury, right? So there's two types of mercury. There's ethyl mercury and methyl mercury. One of them is the one that it was in the thermometers, and the old thermometers that when I was a kid and the thermometer would break, we're like, oh, look, we can play with this, right?
I wonder what 70s, it tastes like.
Right?
Oh boy.
Yeah. And that type of mercury can cross through the blood-brain barrier, and that type of mercury can cause problems in the brain. And we know that not only from individual people who have mercury toxicity from drinking mercury or playing with it because it can be absorbed through the skin or anything like that. But we had seen in 2 different times in recent history where there had been big mercury spills in the water. One of them was in Japan and one of them was in Iran. And pregnant women and babies who were drinking this water ended up having very adverse health issues with global development, gross motor development, fine motor development, speech development, cognitive development. So these fetuses and babies and young children ended up having toxicity from the mercury that they were ingesting. This is the same reason why we tell pregnant women not to eat a lot of big fish,
right?
Because there's mercury in our water supply, and the big fish eat the little fish that eat the plants that have the mercury, right? So it's a cumulative effect.
Yeah. Is that the same mercury that crosses the blood-brain barrier?
Yes.
That's the one. Okay.
Right. That's that one mercury. The other mercury is the one that's found in thimerosal, right? And that mercury is a bigger molecule, and it does not cross a blood-brain barrier, and it's processed really efficiently by the liver, and we pee it out. So at that time, science wasn't 100% sure if thimerosal was the bad mercury or the not bad mercury. And so they took the hepatitis B off the shelf and were like, we are going to study this. Then when they deemed it like, oh, it's the not bad mercury, and then they took the thimerosal out of the vaccines anyway, what it was used for, it was a stabilizer so that, when the vials of 10 doses were out, that the 7th or 8th dose would be as effective as the first dose, right? So it was there to stabilize and preserve it. They took the thimerosal out, and since 99, 2000, there has been no thimerosal in vaccines except for multi-dose vials. And so the multi-dose vials, which usually is one of the forms of flu vaccine, all the other ones have been thimerosal free. So when speaking with people who may be leaning a little bit more towards conspiracy theory, there's like, well, if it wasn't bad, why did they take it out? Again, there are many reasons why they removed it. One of them being it really decreases human error to have immunizations come in pre-filled syringes. You get the dose exactly the same every time.
Right.
The name of the vaccine's written on the syringe. There's just less room for error. And because they're single dose, single-use vaccines, you don't need the thimerosal. But when you're looking at it from a more suspicious point of view, I can understand why people would say, well, if it wasn't that bad, why did they remove it? And now we don't have it in our vaccine. So no, that we don't have thimerosal in practically any of the vaccines except for the multi-dose ones, which most pediatricians don't carry, just because it's so much easier just to give, a single dose vaccine.
Yeah, for sure. Yeah. I also read, and this was just top of mind because I had my baby boy 6 months ago, right? Yeah. So we're like talking about vaccines and stuff, and then we're getting flooded with all kinds of information.
Yeah.
But anyway, I also was reading about SIDS, and the highest likelihood of SIDS happening, I think, is within 7 to 14 days after an immunization event.
Okay, I have not read that.
The reason why I was reading, I just was like, what about SIDS? And I was investigating that. Then again, I don't recall like the in-depth sources that I was reading this from. Of the legitimacy, but I remember a couple sources that I was reading through similarly came up where it was like SIDS, if a SIDS happens, it's like 80% likelihood that it had happened within 7 or 14 days, higher likely 7 days after a vaccine immunization period. And then after that, it decreases 60%, 50%, 40% after 14 days. And it's like cuts off like drastically, like not having SIDS.
I'm wondering if that same data, I mean, it's going to be harder to find than, finding immunization dates. But if that same pattern happens after being exposed to an illness.
You're right.
So if they have, anything that revs up the immune system. Right. I am not aware of that. We do know what causes SIDS. Unfortunately, we don't know who is predisposed to that because there's no way to find out.
What is the cause?
It's an inability for the brain to increase respiratory drive when there is a relative decrease of oxygen. So, for example, if we all climb to the top of a mountain right now, well, you'll probably get there before me, but I
don't know about that.
But when I get there, we're going to be breathing deeper and taking bigger gulps of air in because there's a relative decrease of oxygen at the top of a mountain versus at a lower level, right? So if there is a decrease, or say like we're breathing into a pillow or into a paper bag, we breathe harder and harder as the oxygenation goes down. It's a drive, like a physiological drive that we have.
Yeah.
And these babies lack that drive. And we don't know why, we don't know how, we know something genetic, but we don't know anything else about it. And so the Back to Sleep campaign, which is basically putting the baby on their back so that they have all of this air around them that they can draw from, has decreased the risk of SIDS. And we've seen other things that also predispose somebody to SIDS. So belly sleeping, we know will predispose. If the air is too stagnant, if it's really, really hot and stagnant in the room, that it can also be a risk factor. Smoking around the baby, because it also decreases the oxygen around. And then the other one is co-sleeping. And it's not co-sleeping because you roll over the baby. That's death by suffocation.
Yeah.
It's because you have two adults with big lungs who are exhaling carbon dioxide in the breathing space of a baby who's got tiny little lungs and trying to draw the oxygen in.
That makes sense.
And so when you are looking at all these different risk factors, I like to tell my parents all these things because I believe that knowledge is power. And I would really love to decrease postpartum anxiety and all these things that come up when all of a sudden you have this live baby with no instruction manual coming home with you from the hospital, and explaining this is why the Back to Sleep campaign works. And this is why I say don't co-sleep with your baby. And if you're still worried about SIDS, then run a ceiling fan, or, make sure that there's nothing in the breathing area of a baby, and then you should be okay, because then they grow out of that. Their lungs become bigger, they have more residual volume, and their brains are more developed, and then you lose that risk of SIDS. The problem is that we can't tell which babies are predisposed to this, and then we can't ease everyone else's anxiety.
Right, of course. Yeah. Interesting. I had a professor back in the day that they had a baby years prior that had passed away from SIDS. Horrible. Yeah. Horrible. I wasn't there. I wasn't present when it was happening. Like I had met them years after that, but they still, they would talk about it. They would hold like memorial every year for his birthday. It was very, I'm like, man, I couldn't imagine.
I could not imagine.
It's terrible. My son, when he was born, he, I'm blanking on like the diagnosis, but he was a hemoglobin incompatibility with the mom, and he was in the NICU for 5 days.
With the lights?
With the blue lights. Yeah. What am I? Hyperbilirubinemia.
Yes.
Yeah.
Yeah, you said that very well.
Hyperbilirubinemia. I was researching all about it, So he was born 6 hours. We're in the normal hospital room. 6 hours later, the nurses come in. It's early. It's like 6 a.m. They're like, we need to take him in the NICU. We have this bilirubin spiking. And we think it's this. And we're like, okay, and that was tough. Had to draw blood like through his heel, and like it wasn't coming out well. And I'm like, oh man, I've seen this little baby like on a blue light. Can't hold him. We were holding him a little bit like to nurse.
Yeah.
And then his levels weren't regulating. So we're like, we need to like not pick him up and like just crush these blue lights. So it was hard,
It's very hard.
But bless my wife, she was there all day and all night. And I went home with the other kids, managing them at home, and we'd go visit every day. And this was over Thanksgiving. But fortunately, everything was fine. They're like, it was tough. But everything worked out. After that, do you have any, like with infants that you see after birth, they're home, hyperbilirubinemia, is that a common, after like a couple of days, it's like, you're confident it's not going to happen?
Correct.
Okay.
Yeah.
And then after that, any complications with babies afterwards?
Nope.
That's what I've heard too.
So it's in the time that you're dealing with it, you want to make sure that bilirubin is low enough that doesn't cross into the brain. And that's really why people get very excited about it. And then after the bilirubin levels start coming down, and then it's never an issue ever again for the regular ABO incompatibility or that kind of stuff. There are some syndromes that that lead to hyperbilirubinemia that can be diagnosed and can be confused in the very beginning. But that's why we have so many visits in the very beginning of life, where we're always like eyes on the child just to make sure that's not one of these weird things out there.
Yeah, for sure.
But it's sad because, you miss out on the maternal bonding with the baby and the stress of being in the NICU. And,
for sure.
But there's nothing else to worry about.
That's good. And so you mentioned preventative health, with kiddos. What do you recommend with that? Besides eating well,
so much.
You said eating well.
Yeah.
Can you trace back where this thing is from? Yeah. Where's the Pop-Tart tree?
Right, exactly.
I don't know if there is one. Then maybe let's pass. Let's limit this a little bit. Yeah. So preventative health. What are your recommendations?
Well, it depends on the ages and the stages.
Okay.
So in the tenets are probably all the very similar pillars that adults are used to, right? So nutrition is being one of them that we touched on. Sleep is huge. Sleep is probably one of the most important things out there. You have so much stuff happening during sleep that, knowing what a normal sleep looks at different ages, and then making sure that you're hitting those, not only just the length of time that you're sleeping, but the right sleep patterns.
Yeah.
So babies spend a lot of time in REM sleep. That's why they're like these little goblins at night that you're like, what is this noise coming from the bassinet next to my bed? They're snorting and they're moving and they're grunting and but all that's like normal sleep. So knowing what sleep looks like at different ages and different stages and trying to maximize the amount of sleep. Movement's very big. And, I'm a big proponent of play. I think us grown-ups should be playing more too. I mean, play is so important, not just for the physical body, but for the brain and social development and everything. So, and then prevention of accidents, disease, harm prevention. You don't want to be encouraging different high-risk behaviors, and they look different at different ages, right? So usually when there's a spurt of psychomotor development, there is a peak in accidents. So you see that in toddlerhood, where they're all of a sudden they're learning how to run and climb and do all this stuff. Then we have accidental deaths. When we have adolescents who have this big spurt in like their psychosocial development, they have, these accidents that adults wouldn't be having in terms of like motor vehicle accidents or boating accidents, drowning, things from, getting access to something all of a sudden and then not having the tools to do it safely.
Yeah, of course.
Yeah.
With the nutrition thing, you're familiar with the Huberman Lab, right? That cool podcast, Andrew Huberman. You should check it out. It's really interesting. But anyway, there was a couple podcasts I listened to him, and he was talking about alcohol. Like, there's no benefit to alcohol.
I would argue that.
Oh, you would? Oh, yeah. Tell me.
Oh, no. I just enjoy my wine.
Yeah. Oh, yeah. Well, I enjoy it. It's good for your soul.
Yes,
all right. And yeah, for sure. I feel really good when I'm drinking.
Yeah, right.
That helps. But anyway, I guess what I was saying was oh, it's good for your blood. Like a little bit of red wine, like whatever. It's like, that's been disproven. It's all toxic. I haven't kicked it myself yet. Like, I enjoy a couple of drinks on the weekend, of course. When the kids get to bed and it's like, okay, finally, good rest. With candy and like treats and stuff with the kiddos, are you like, hey, moderation, it's totally fine? Or are you like, try to avoid any candy and sugar?
So now we're talking a little bit more, not so much of what the body requires, but what socially and developmentally a child would gravitate towards. So any type of extremism, absolutely don't do this, don't do this, don't do this. And a child who is developing their brain and being curious and adventurous, they're going to probably end up overdoing it. And this can apply to anything, whether it's candy or anything they say absolutely not to a child, and be very strict on that. But in moderation, I mean, you should not, these things are called treats, and you don't have treats every day, right? A treat is a special occasion thing. So for birthday parties and maybe Christmas or Halloween or something like that, then you can have a treat. But if you have a treat every day, then you kind of take away that being a treat.
Yeah.
And
it's normalized almost.
Right. And say this is one of the food groups.
Yeah, exactly.
Today I heard somebody say, there should not be the term junk food. Either it's food or it's junk. But junk food should not be its own thing. So when you start looking at it through that lens and going, this is junk. And so every once in a while you go to the thrift store and you buy a piece of junk, right? Every once in a while you have, some Smarties. Those are my favorite junk.
Oh, Smarties? Yeah,
Smarties.
Those are good.
Yeah, those are good. Then, you without demonizing it, but also not being super permissive with it, because everything is a balance in parenting, as we all know. And by coming down really hard on something, I mean, there are some things that you will say absolutely no to, like, no, I'm not going to, allow you to experiment with meth. No, absolutely not.
Or like lighter fluid and like just light stuff on fire.
No, not going to do that. But, if I demonize something that is at your cafeteria table, you're going to be really curious about it. And why? And why does everybody else get to do this and not me?
Yeah.
The other kids are not playing with lighter fluid or meth at the cafeteria table, but they might have a Pop-Tart. So, just saying, we don't eat that here. You can have a bite if you want. It's not good for you. It's junk.
Yeah.
But, and then you parent that way.
Yeah. Do you give suggestions on alcohol with teenagers and stuff?
What do you mean by suggestions?
As in, like, I guess the same thought of like, don't want to demonize alcohol because in terms of like, oh, why is it so, I want to try that.
Right.
I've heard different schools of thought, I mean, I don't see us doing this, but I know of parents and people that I had previous experiences with, like their parents were like, yeah, just, you can have a couple drinks, you're graduating high school or you're a junior now and everyone's driving. At least we know that I'm taking your keys. So no one's driving, but at least I know everything's controlled.
Right.
Versus like, no, don't drink until you're 21. There's a reason, frontal lobe development and like brain development, whatever. What are your thoughts on that?
Well, I like to nerd out on the science of it and explaining to kids, the drinking's one thing. I think one of the bigger threats comes at a little bit of an earlier age, and it's with the vaping that we're seeing a lot in the middle schools. And
it's crazy.
It's horrible. It's horrible. And being able to explain, whether the child has thought about it or not, I just go into it when they're 10, 11 years old, and I just talk to them about, this is what it does to your brain. This is what it does to your body. This is why we say no. And I just keep reiterating it. I think a lot of these things, like the vaccine talk and the drugs and alcohol talk and the sex talk, is something that you start at a relatively early age, at age-appropriate language, and then you just build on it as it goes on, and then give the kids the tools to say, this is why we don't do this at this age.
All right. Yeah, I gotcha. So you're like staunch, like, don't drink any, like...
No, I can't say that, because I grew up in a Spanish household and we had wine at dinner from a very early age, but it was not glasses. It was a sip here, a sip there. And when I came to the age in high school where people were having parties, and I'm like, why is everybody drinking like the world is going to end like 30 seconds from now? Like,
you haven't drank before?
Yeah,
like, relax.
What's up?
Yeah.
What's up with that? And then I would go spend my summers in Spain, and it was a social thing. You just go out and you have a drink, maybe not. And then, it wasn't to the point of, with the end result, getting drunk.
Yeah.
Right.
Yeah, for sure. I've heard a couple of Europeans say that, like, why do Americans just like crush and be like drink so much?
What's with the red Solo cups and what's up with that?
That's funny. I've also, with the sleep thing, I've heard that from multiple sources where it's like the benefits and like the necessity to get quality sleep, where it's like, all right, I want to really get in a health kick and like really change my life and trajectory. First things first, what do you do? And it's like, focus on your sleep.
Yeah.
That's what I've heard from a lot of people.
Sleep is so important.
It's interesting. I was talking, microbiome.
Oh, I love that. Love the microbiome. Yes, we have a whole world inside of us. And, there's all these different bacteria, right? And everything's like in this homeostasis, in this balance. And by eating different foods, right? So if we eat a different variety of foods, we are introducing different advantages by either the bacteria or the yeast or whatever that we're consuming. And we have to be able to sustain that. And when there is when it goes off kilter, right? So you have a stomach bug and you kind of wash everything out, or you're taking antibiotics and you kill off a whole bunch of things. Or if you have just a really ultra processed, narrow diet, you're going to throw everything off on the inside of the gut. And, the gut is where most of our neurotransmitters are made.
Huh.
And
interesting.
So if you want your serotonin hit, eat well, right? Make sure you're sustaining your microbiome so you can produce the right balance of neurotransmitters.
Interesting.
So there's a very strong gut-brain connection, and a lot of people don't listen to the gut. So, making sure that there's, it becomes a loop. So people who have chronic constipation or chronic diarrhea, you're not able to stop that cycle because, you're not restoring that bacteria that's either causing it or not allowing it to heal.
Yeah, interesting. Are there different foods associated with different neurotransmitters?
Yes, and
like
I
if you
don't
want a
know
lot of
them off the top of
serotonin,
my head, but
eat
yes,
strawberries. If you want like dopamine, eat this.
yes.
Or
So it's not
norepinephrine,
necessarily the
eat chocolate.
foods, but the bacteria that thrive off of that food.
I
Yeah.
see. Okay,
Yeah.
interesting. Maybe in a conversation another time then.
Yeah, I've got to read up on it.
That's awesome.
Yeah,
That's really cool. All right, then risk factor avoidance. You mentioned like screen time.
Oh, I hate screen time.
Yeah. So screen time and vaping, you would say on your top 2 lists of like, don't do that.
Yeah.
Yeah.
I think so.
Yeah.
I'm sure I can find other lists, but
screen time. Describe screen time.
Is I think screens cause a lot of harm inherently because of what they are, right? And then they also cause a lot of harm from what they take away. So things that they can take away from interpersonal development, right? They take away from play. They take away from knowing conflict resolution and how to speak with other people. And we have this whole generation of kids who really don't know how to engage in small talk, because if we're all sitting waiting at the bus stop together, everybody's going to be in their own little world and they're not going to talk. Right. So we're losing all of that as a society, and
totally agree.
And it's really, really sad.
Yeah.
And then what it does, so those are things that it takes away. And then I'm sure I'm missing some, but things that it causes sleep disruption. It causes, it's been linked to the mental health crisis that we're dealing with right now with children and adolescents. We have the social media component that, speaking of dopamine, that these algorithms are written by these psychologists that know how to keep us addicted and how to scroll and how to do all these things that we're like, you can't just stop by looking at your phone for 30 seconds. You have to keep going and keep going and keep going. And then time is lost and you're not talking to anybody. And now you're feeling bad about yourself because everybody on the screen have happier, healthier lives than you are, and you suck. And you know, and so you can go down this rabbit hole. And then there's the discernment of information. Like, how do we know what we're seeing is real?
Yeah.
And so now we're in the state that we're in right now, both socially and geopolitically and everything and I blame screens for all of 100%.
That. Yeah. I think it's crazy that there's hired professionals, how we can really manipulate people.
Yeah.
Like do these things and these algorithms, and that's how you get people addicted.
Yeah. And increase the intensity of light here and say this word here. And it reminds me a lot of the food chemists that try to make chips, like you have to eat the whole bag and not just one.
Yeah.
Right. It's like that same type of, I went to
craving addiction.
I got a master's in psychology for this. Right.
Yeah. That's cool.
But yeah, I'm very sad about the screens. The American Academy of Pediatrics recommends 0 hours of screen time a day for children under the age of 2. And then during the time of COVID, they kind of backtracked a little bit and said, well, if you're FaceTiming, then that is the social connection that we need right now, in the height of COVID. And then they never took that back out. So now we are allowing FaceTime as permissiveness of screen time in babies. But there are studies and there's data out there with linking the amount of screen time with problems with the developing brain.
Interesting.
And one of the ones that I recently read about was the increase of eye pathology in children because of screen times, and it's linked to how many hours per day. So if you're if you're, an infant and you spend more than 1 hour in front of a screen a day, then you have like 21% more chance of needing glasses because your eyesight's going to, have problems with myopia or astigmatism or something like that.
Interesting.
So it depends on the age because your brain is there, right?
Yeah.
The eyes are part of your brain, and it depends on the age. It depends on the intensity, and there's no reason why an infant or toddler needs to be on a screen.
Yeah.
Absolutely none.
Television, same thing.
Television's a screen.
Yeah, interesting. I remember watching a lot of television when I was a kid.
Yeah.
It's just but then again, we also didn't have phones, so the same way we do now. Where I totally agree. Like, then the social development and the ability, like just the social intelligence, conversations, the emotional intelligence, it's just, it's a bummer.
And even as a family unit, you go to a restaurant and you see, two adults on a screen, you see the kid with the iPad, the other kid with the iPad, and nobody's talking to each other. And, your kids are only going to be this age one time.
Yeah. For sure.
And you're going to miss out. And so what if they have a meltdown? Everyone has a meltdown. I had a meltdown yesterday. We can all have meltdowns.
Yeah.
But being able to work through that, and it just makes the whole unit so much stronger.
Yeah, totally. I totally agree with that.
I really did not have a meltdown yesterday. I was just part of the point.
Yeah, I got you. Like meltdowns happen. Yeah. I'm having a meltdown right now. No, I totally, it's a bummer. I just think like, considering some of the young kids right now that in 20 years or 30 years from now, they're going to be the main drivers of the economy and stuff, what's that going to look like?
Right.
Probably a lot more manipulatable, not great socially intelligence. If they're just never had that, you know what I mean? Conflict resolution, like you said, emotional intelligence, navigating challenging waters.
Right.
I don't know. It's tough.
I know. And part of me, I'm like, am I now like my grandparents, like back in my day, right?
Exactly.
Is that what I'm trying to say? I'm like, no. I mean, it's a sadness. It's a yearning for like simpler things. It's it's a tool. The screens are a tool, and it should be used as a tool. Like just like you would use a drill as a drill, but you're not going to use the drill as a hammer, and you're not going to apply that tool to everything, right?
Yeah.
So knowing the useful part of it, then applying it and then using play as play. I'm not going to play here by myself. I'm going to go outside and play, or I'm going to play a board game, or I'm going to make up a story and tell people or whatever. And using your creative mind to be able to make life sweeter than looking at a screen.
Yeah, for sure. Totally agree with all that. Awesome. Well, I appreciate, let's land the plane there. We're open for other conversations down, next time. We have plenty we could talk about, but, no, thanks for coming in. Cause I know you're busy and stuff. What's the best way people can reach out to you?
So you can find me, speaking of screens, you can find me on a screen. My website, my practice name is More Healthy Kids. My last name is Dr. Moore. So it's Moore. My phone number is 561-834-5528. My office is right here on Olive, right down the street here. And my Instagram handle is at More Healthy Kids.
Cool. Yeah, I love the name, More Healthy Kids.
Yeah, it's fun.
It's perfect. Yeah,
I love it. That's my goal.
Well, thanks again for coming in. We'll have to, get round 2 in there and talk more about some other stuff like systemic disease down the road, your nonprofit in Ghana.
Yeah.
What's all of that?
Yeah, I'd love to talk about that too.
Yeah, for sure. So thanks again for coming in. And if y'all have any questions, we're always open to answering questions, comments, concerns, conflicting opinions, whatever. If you're battling any pain, if it's like shoulder pain, back pain, neck pain, we love to help. You can at least talk on the phone and get some opinions and some insights. And the best way to reach us is probably our phone number too, 561-899-8725. So don't hesitate to reach out any questions, and reach out to Dr. Moore for any pediatric questions.
Absolutely. I'm here to help.
We'll catch y'all next time.